Frank was a 67-year-old former accountant who came to his doctor complaining of occasional heartburn and trouble swallowing. His physician, Dr. Martinez, noticed something the moment Frank walked into the examination room. His head jutted forward significantly, his shoulders were rounded, and his upper back had developed a pronounced curve that created a hunched appearance. Dr. Martinez didn't just treat the swallowing problem. She ordered a bone density scan, referred Frank to a physical therapist, and scheduled follow-up tests for his heart and lung function. Frank was confused. He'd come in for heartburn, not his posture. But 6 months later, after his bone density scan revealed osteoporosis, after physical therapy significantly improved his balance and prevented what could have been a devastating fall, and after breathing exercises helped expand his compressed lung capacity, Frank understood. His posture wasn't just about appearance or comfort. It was literally a window into his future health, showing problems that were already developing and predicting others that were likely coming. Welcome to Elderly Discoveries, where we explore the health insights that can transform your later years. Today we're looking at something you see in the mirror every day but might not truly understand. Your posture. The way you stand, sit, and move right now is revealing critical information about your bone health, fall risk, heart and lung function, pain trajectory, and even your longevity. And the remarkable thing is that unlike genetics or past health history, your posture is something you can actually change. Let's start with what doctors like Dr. Martinez observe when an older patient walks through the door. The forward head posture that Frank displayed, where the head juts forward instead of sitting directly over the shoulders, is one of the most common postural problems in older adults. For every inch your head moves forward from its ideal position, it adds approximately 10 pounds of stress to your neck and upper back muscles. Most people's heads weigh between 10 and 12 pounds, so if your head is 3 inches forward, your neck muscles are working to support 40 pounds instead of 12. This creates chronic muscle tension, yes, but it also does something more insidious. It compresses the structures in your throat and can contribute to swallowing difficulties. Exactly what Frank experienced. Studies have shown that forward head posture is associated with decreased swallowing capacity and increased risk of aspiration, where food or liquid goes down the wrong pipe. In elderly individuals, aspiration can lead to pneumonia, which is a leading cause of hospitalization and death in seniors. So that forward head position isn't just causing neck pain, it's predicting serious respiratory complications. The rounded shoulders and hunched upper back that often accompany forward head posture create what's called kyphosis, an excessive forward curve of the thoracic spine. Mild kyphosis is normal, but when the curve becomes pronounced, creating that dowager's hump appearance, it signals multiple future health problems. First and most obviously, it often indicates osteoporosis. The vertebrae in your spine are literally collapsing forward under compression, often due to tiny fractures called compression fractures that occur when bones become fragile. Research published in journals focused on geriatric medicine has shown that the degree of kyphosis directly correlates with bone density. The more pronounced the curve, the weaker the bones typically are. This matters enormously because osteoporosis doesn't just affect your spine. It affects all your bones, dramatically increasing fracture risk. Hip fractures, wrist fractures, and additional spine fractures become increasingly likely. And in older adults, these fractures can be life-altering or even fatal. But the problems with kyphosis extend well beyond bones. When your upper back curves forward excessively, it compresses your chest cavity. Your lungs can't fully expand because there's literally less room for them. Studies using pulmonary function tests have demonstrated that people with pronounced kyphosis have measurably reduced lung capacity. They can't take deep breaths, their oxygen exchange is compromised, and they become short of breath more easily. This creates a vicious cycle where reduced lung function leads to less activity, which leads to further muscle weakness and postural decline, which further compresses the lungs. The impact on cardiovascular health is significant too. Your heart sits in that compressed chest cavity, and the altered biomechanics affect cardiac function. Research has shown that elderly individuals with severe kyphosis have higher rates of cardiovascular disease and reduced overall survival rates. Now let's talk about balance and fall risk, because this is where posture becomes literally a matter of life and death for older adults. When your head moves forward and your upper back rounds, your center of gravity shifts. You're no longer balanced efficiently over your base of support. This means your muscles have to work harder just to keep you upright, and it means you're biomechanically less stable. Studies examining fall risk in older adults have found that postural alignment is one of the strongest predictors of who will fall. People with forward head posture and increased kyphosis have dramatically higher fall rates than those with better alignment. And we know what falls mean for seniors. They're the leading cause of injury and injury-related death in adults over 65. A hip fracture after age 75 carries up to a 25% mortality rate within 1 year. Many people who survive never regain their previous level of independence. So when a physician sees poor posture in an elderly patient, they're literally seeing increased fall risk and potential future disability or death. Chronic pain is another future health problem that posture reliably predicts. When your body is out of alignment, certain muscles become chronically tight, while others become weak and overstretched. The tight muscles develop painful trigger points. The weak muscles fail to support your joints properly, leading to joint degeneration. Forward head posture is strongly associated with chronic neck pain, headaches, and shoulder pain. Rounded shoulders contribute to rotator cuff problems. A swayback posture where the lower back curve becomes excessive predicts chronic low back pain. The research is clear on this. Multiple studies following older adults over time have shown that poor posture at baseline predicts the development of chronic pain conditions years later. This matters because chronic pain in elderly individuals leads to reduced activity, depression, social isolation, increased medication use with associated side effects, and reduced quality of life. Here's what makes all of this particularly important. Posture is modifiable. Unlike many age-related changes, you can actually improve your posture at any age, and doing so can literally change your health trajectory. Frank's story demonstrates this beautifully. After 6 months of targeted physical therapy, his forward head posture improved significantly. His kyphosis, while not completely corrected, was noticeably reduced. His swallowing problems resolved. His balance improved measurably on standardized tests. He reported having more energy because he wasn't working so hard just to hold himself up against gravity. The physical therapist taught him specific exercises to strengthen his upper back muscles, stretch his tight chest muscles, and retrain his postural awareness. He learned to set up his computer workstation properly, even in retirement, because he spent hours on his computer and that environment was reinforcing poor posture. He practiced chin tucks to retrain his head position. He did wall angels to open his chest and strengthen his shoulder blade muscles. He worked on core strengthening to support his spine. The scientific literature supporting postural intervention in older adults is robust. A study published in the Journal of the American Geriatric Society took elderly women with hyperkyphosis and put them through a targeted exercise program. After 6 months, the participants showed significant improvements in their spinal curvature, increased walking speed, improved balance, and better quality of life scores. Another study found that postural exercise programs reduced fall rates in older adults by nearly 40%. That's a staggering risk reduction from something as simple as improving how you hold your body. Research on breathing capacity has shown that exercises targeting thoracic extension, basically movements that open up the chest and straighten the upper back, can improve lung function even in people with established kyphosis. So what should you do with this information? First, assess your own posture honestly. Stand sideways in front of a mirror, or have someone take a profile photo of you standing naturally. Look at where your head sits relative to your shoulders. Is your ear directly over your shoulder, or is it inches forward? Look at your upper back. Is there a pronounced curve? When you sit, do you automatically slump forward? Do you have to consciously pull yourself up to sit straight? And does that position feel unnatural or tiring? If you're seeing postural problems, don't dismiss them as inevitable aging. They're not. They're modifiable risk factors for serious health problems. Second, consider working with a physical therapist who specializes in geriatric care or postural rehabilitation. They can assess your specific imbalances, identify which muscles need strengthening and which need stretching, and create a personalized program. If access to a physical therapist is limited, there are evidence-based exercise programs designed for postural improvement in older adults that you can find through reputable sources. Third, look at your environment. How is your furniture arranged? Is your television positioned so you have to crane your neck to watch it? Is your computer screen too low, causing you to look down for hours? Are your chairs supportive or do they encourage slumping? Small environmental modifications can make a significant difference in the postural habits you develop throughout the day. Fourth, build postural awareness into your daily routine. Set reminders on your phone to check your posture. Practice the exercises your physical therapist recommends consistently, not just occasionally. Understand that changing posture that's been developing for years or decades takes time and persistence, but the payoff in terms of future health is enormous. Frank's doctor saw past his immediate complaint and recognized the bigger picture his posture was revealing. That clinical insight led to interventions that likely added years to his life and definitely added life to his years. Your posture right now is telling a story about your future. It's predicting your bone health, your fall risk, your breathing capacity, your pain trajectory, and your overall vitality in the years to come. The question is whether you'll read those signs and take action. Because unlike so many aspects of aging, this is one you have the power to change, and changing it could transform your health journey in profound and lasting ways.